I had my wisdom teeth removed last week, and now I'm pretty convinced I'm a superhero. Yes, my wisdom teeth were extracted, pulled out. See ya later, wisdom. Wait, that doesn't sound good. And the whole affair went better than I expected. I was a bit nervous for the surgery because I've never had this kind of operation done, and I've never had anesthesia. I've seen all of the videos of people who've had their wisdom teeth out when they're waking up from the anesthesia and they say embarrassing things and hilarity ensues. If that was gonna happen to me, I wanted it to be filmed. I wanted to know what I revealed in there. I mean, I certainly wanted to know if I talked about that unfortunate accident I was involved in. There were no survivors. Oh, did I say that out loud? Never mind. So I wanted to do like a before and after kind of thing. I filmed myself before the surgery on the way to the oral surgeon with my mom, all of my nerves steeled. And this is what happened.
Alright, I'm on my way to get my wisdom teeth out. Kinda nervous. I don't know what's gonna happen in there. But,
Take
here
one
we
last
go.
look at this face.
This is it. This is it! See you later.
Then I told my mom to film me when I first woke up, and we'll get to that in due time. So when I arrive at the oral surgery place, there's gotta be a more official name for that. Oral surgery facility place. I don't know. I wait for a few minutes and then I'm called into a room. Called to my destiny. And the hygienist in there is very friendly. She tells me what to expect and how I will have to be changing gauze pads and icing my jowls afterward. She didn't actually use the word jowls, but I like that word and I feel it's woefully underused, so I'm trying to fix that. She also tells me that I can't eat anything solid or crunchy for a few days, which is bittersweet, as it means none of my favorite Ben & Jerry's flavors or cookies for a while. But I had already stocked up on a boatload, more like a yacht load, of pudding and applesauce, so I was happy about that. Then she tells me that the surgery will be very quick, and when the doctor comes in, everything will happen really fast. He'll stick an IV needle in me and put an oxygen cannula on my nose, and I'll doze off in a flash. And then the operation itself will take about 20 minutes, and I'll be shaken awake soon after that. So I'm hearing all of that and getting mentally prepared, and then the doctor and another hygienist fly in, and we're in business. I was told the doctor would move fast, but he seems almost ridiculously quick, as if he's not even paying attention. He's like, so anyway, I said, you're gonna have to sign up for an AARP membership one of these days. You're getting old. We had a good laugh about that. Alright, wisdom teeth. Hey, how you doing? I'm just gonna put this in your nose. There we go. And hey, drinks on me after the operation. Am I right? Am I right? Just kidding, but not really. Here's the needle. There it goes. Boop. And bye-bye. Have a nice snooze. He's gone. Where are my pliers? That may not have been a word-for-word reenactment, but it was close. So when I finally wake up, which feels like an instant after I went under, my mom films me, and the results are less fascinating than I expected. See for yourself.
All right. This is Parker post-op, right after surgery, still in the chair here. Can't talk very well. More to come. In a bit. Okay.
Yeah. Wow. I guess I didn't reveal much of anything. I was just vacant. Luckily, I didn't mention that unfortunate accident. Dang it, I gotta stop talking about that. The police haven't proven anything, so it's good. It's cool. Anyway, I head on home and spend the day replacing gauze pads, taking some painkillers, and making an endless number of jokes revolving around the fact that my ice pack makes me look like Jacob Marley from A Christmas Carol. Ebenezer Scrooge. Because those jokes never get old, and I've heard a lot of horror stories about the recovery process after this operation, so I'm expecting the worst over the next few days. I finally work up the courage to use my prescription mouth rinse, which I'm assuming will sting horribly when it makes contact with the open wounds in my mouth. I'm expecting... But instead I get... So that's a pleasant surprise. I'm lucky in that I don't swell up too much and the pain doesn't seem too terrible. So I lay off the pain medication the next couple of days because I don't really need it and I don't want to get addicted. Also, part of me wants to be like the main character in an action movie after he survives some kind of horrible explosion when he's in the hospital and everybody's looking at him and they say, he's been in excruciating pain, but he's denied any pain medication. What a hero. And now it's been almost a week and I have some jaw soreness, but it's not too terribly bad. All of the friends I've seen who've had this surgery are just mad at me. They look at me and say, come on, I was swollen and bedridden for a week. You're like, fine. You know what, I can't even look at you. Just don't even say anything. Just shut your mouth, just shut it. So I've come to the natural and perfectly logical conclusion that I must be superhuman. My mom theorized that I have some sort of Wolverine-like healing ability, and I don't think she's too far off. I mean, any situation in which I'm compared to Hugh Jackman is a welcome one, so I'll take it. And I can start to consume normal foods again. I managed to get down a 4th of July brownie sundae pretty easily, so I'm on my way. Anyway, I think the lesson here is that you don't have to go into a situation expecting the worst, because it can cause you a lot of unnecessary stress and worry. So be optimistic. And who knows, maybe you'll discover previously unknown superpowers. Or you'll just get to eat a lot of pudding. Good either way, win-win. Now, I have to go design a tooth-themed spandex suit in which to fight crime. Name-wise, I'm thinking Captain Canine. Just brainstorming. I'll catch you later.